Thank you, Minister. I wanted to provide some details about what we know about the level of protection provided by a first dose of either the Pfizer or the AstraZeneca vaccine. As you know, it's essential that people receive 2 doses of each of these vaccines. For the Pfizer vaccine, that's 2 doses 3 weeks apart. For the AstraZeneca vaccine, that's 2 doses 12 weeks apart, although a shorter time interval may be appropriate in some circumstances. A single dose of either vaccine is effective at protecting you against being infected with COVID-19 and developing severe symptoms. This protection commences within a few days of vaccination and then increases over time. We're still learning about asymptomatic infection in vaccinated people. We're still learning about the development of mild symptoms in vaccinated people. And we're still learning about the risk of vaccinated people being able to transmit the virus to other people. But the best data that we have on the effectiveness of first doses of vaccine comes from the United Kingdom, which has, of course, also rolled out the Pfizer and the AstraZeneca vaccines to their populations. And the UK research has shown that for people aged 70 and above who've received either the AstraZeneca or the Pfizer vaccine, there is a 50% reduction in serious disease and hospitalisation within 2 to 3 weeks of that first dose, and an 80% reduction within 4 weeks of that first dose. So first doses do work and they provide protection. As people build up protection, it's still important, of course, that they continue COVID-safe practices to protect their own health and the health of others. And both the Pfizer and the AstraZeneca vaccines require the full 2-dose course for the very best long-lasting immune response. While partial protection against COVID-19 may be in place as soon as 12 days or even earlier after the first dose, this protection is likely to be short-lived unless you have the second booster shot. And it's the second shot that encourages your body to create stronger protection or immunity against the SARS-CoV-2 virus that causes COVID-19. So my message is, please do not delay in being vaccinated if you are currently eligible, whether in Victoria or elsewhere in the country. And please, if you are responsible for providing consent for an elderly parent or another relative, and if you have any questions, please talk to your trusted GP, nurse, Aboriginal health worker, pharmacist about the vaccine. We know that just over 50% of people aged over 70 across Australia have now received at least 1 dose of a COVID-19 vaccine, but that also means that just under 50% of people are still at risk of serious illness and risk of death if infected. And it's also important that we are all vaccinated, and when it's our turn, because some people may not generate as strong a protective response as other people. And this is particularly the case for some very frail elderly people and for people with health conditions that affect their immune system. So by being immunised, you're not only protecting your own health and well-being, but you're also protecting everyone else in Australia. Being vaccinated shows that you care about everyone else in our country.